Vanakkam, all my friends from Tenkasi, doctors, nurses, other healthcare professionals, Abhilash, Praveen, and all volunteers. Happy to greet you in the season of the World Palliative Care Day. Can I tell you a story? Just a few years back, in one of the major reputed hospitals, not far away from Chennai, a 16-year-old girl was discharged from the hospital. She was an orphan. She was a tsunami victim. Her parents had died, and she and her younger brother were left. The extended family, at that time of intense suffering and poverty, rejected them. They grew up on the streets. Rani, the 16-year-old girl, unfortunately, about a year back, got an osteosarcoma of the lower limb. They wanted to amputate the limb, but because she had no adult family member, the hospital could not do it. No consent, you see. The tumor got ulcerated and got maggots crawling around them. It was intensely painful, and she was stinking from the pus. For the surgery, the hospital wants consent from an adult. For an orphan, it's better to pretend that they do not exist. But you cannot ignore the stink. You cannot ignore the girl's screams in pain. The hospital discharged her, just took her out one morning and laid her out on the pavement beside the road and went back. An Ayush doctor, whom I never have met, but for whom I have the most respect, he was not only a doctor, he was also a human being, couldn't bear to see this sight. He took her with him. He had a small clinic, which was only outpatient clinic, but he kept her there, housed her, and then sent out emails all over the country about the girl, about getting her some help. And one of the emails forwarded by a friend from Delhi reached us in Pallium India. We immediately contacted a palliative care doctor in that city. He made inquiries and found that the girl had been taken away to a terminal care center. So the next day, this doctor and a volunteer medical student, Dr. Srikanth was the doctor, took her in a vehicle, went to meet her in a vehicle after driving for a couple of hours, and found that the institution had no pain relief and no medical treatment facility except for a visiting doctor who would visit occasionally. They had taken morphine with them. They gave morphine to the child. In about an hour, she was reasonably pain-free. She immediately started calling the doctor Ayya and the medical student Anna. They took her in the vehicle. On her way, before that, they had removed as many maggots as possible, and the wound was dressed. It was still not smelling good, but it was much better. They took her in that vehicle, and on the way, the girl wanted them to stop the vehicle when she saw a shop. Anna, Fanta. She wanted Fanta and a favorite snack. They gave it to her. She would not have had many bottles of Fanta in her life, you can imagine. They went to the palliative care center, and in between was transferred from one after the initial treatment where the maggots were got rid of, the pain relief was better. Then they moved her to a home where ordinarily they would serve vegetarian food, but the girl wanted chicken. And hospital authorities, the doctor, changed the rules and got chicken curry sent over. She wanted a television. So from the living room to her, where she was laying at, television was moved. The girl died without pain, eventually in about a week, died without the stink and without the worms crawling over her body, giving her some dignity. She died loud. Unfortunately, her brother had gone out fishing in a fishing boat, which would take 2 weeks to return, so could not see her again. But she died as a human being. Friends, when I was thinking of talking to you, the girl immediately came to my mind. She needed the doctor. Any amount of love would not have helped enough. She would not have enjoyed the Fanta when her mind was totally submerged in the pain or the self-loathing which comes with a stinking body, self-loathing which will come with the maggots creeping over them. She needed a medical system which was not only looking at diseases, but also looking at suffering. She needed the volunteers. She needed the community who would get her the Fanta and the snack and the chicken curry and the television. She died after satisfying some of her wishes. She lived for a week as a human being and eventually died. It gives me a lot of pain to think about the suffering she had to go through, but it also fills me with gratitude for Providence and gratitude for all those doctors and volunteers who gave her dignity back. Friends, about 1 crore of people in India are in serious health-related suffering, not only from cancer, from many diseases. Only less than 4% of them get any pain relief, any palliative care. Palliative care is something to be integrated into all healthcare. That is the global decision by World Health Organization. Government of India has now included palliative care in its national health policy. The MBBS curriculum from 2019 and the nursing curriculum from 2022 officially include palliative care. But there is always an implementation gap. I honestly believe that Kerala today has 16 times more palliative care than the national average, only because the community got involved, showed the way, and also because a large number of doctors with essential humanity in them took the trouble to lead the program and make palliative care accessible and visible so that the rest of the country could follow this example. Friends, the pain relief, the dignity, and the appropriate end-of-life care were all important. This cannot be done by the community alone. Professionals have to be there to look after the physical suffering that can be overwhelming. And the community has to work together with them. The medical system has to open its doors to welcome the community. And by working together, a lot of needless suffering can be alleviated in this country, and we can be proud of our humanity once more. Friends in Tangasi, I hope your mission will succeed. Palliative Care Day message this year is Together for Palliative Care. And we all have the duty, we have the responsibility to make sure that reasonable comfort reaches people who are suffering needlessly today. Palliative care is not expensive. There are always willing people who are eager to get some meaning to their lives by helping others. It's just a question of getting them together, giving them the training. And let me also tell you that compassion alone is not enough. Compassion has to be balanced with competence. The volunteers need training. The doctors need training. Now it's coming into the curriculum. But what about the doctors who qualified without learning this? They need training in this. And we are there to help. We can provide training. Our team, I know that my team members have been with you. Lalit has been with you. We will work with you, friends. And anytime we have a telehealth facility, a doctor or nurse getting trained, any member of the community needing help for a patient can call us, and we can get into a video call or at least a phone call if video call is not convenient for the caller, to register the person with us and to give the best possible care virtually, or to connect you with a palliative care center close by. Friends, I wish all the best for your mission of compassion. May your tribe increase. May you all get a lot of satisfaction from wiping a lot of tears. May you together make sure that a lot of needless suffering is removed from our people. Thank you very much. Vanakkam.